A new facility in the Wenatchee Valley designed to assist those who are going through a mental health crisis is nearing completion and will soon begin admitting people in need. The Parkside Crisis Stabilization Center is located on the site of the former Parkside Nursing Home, and its realization has been part of a long and steady labor of dedication and care for the region's mental health services community by its program director, Dr. Julie Rickard.
So the idea of this facility is that it's going to be a hub for patients that previously fit into no specific category and so would really get sent home even though their mental health worker or their physician might believe that they're not safe and they're not able to be safe, but they don't fit the imminency criteria to get detained. So our goal is really to triage people coming in and to vet them to the lowest restrictive criteria. So what that could mean is that we meet with them, we determine, you know what, I think you're able to be safe, you just need some support. So we're going to see you over the brief time to make sure that we're managing you as an outpatient. Then the next level would be maybe as a 23-hour, we're going to do an observation of you, let you come in, get away from whatever context might be driving this crisis, give you 23 hours to kind of cool off, check back in, work on some brief cognitive behavioral therapy. The next level would be up to a 14-day stay in our crisis facility, which is this facility. And people are coming in voluntarily. This isn't something that they're being mandated to do. There's no court order involved. There's no, if they feel like they can be safe on their own at any point, then we would discharge them.
The new Parkside facility is owned and operated by parent company American Behavioral Health Systems, and Dr. Rickard steps into the position as its program director with a 14-year background in behavioral health and also as one of the founding anchors of the Suicide Prevention Coalition of North Central Washington.
Part of being the director for the Suicide Prevention Coalition is really looking at suicide-safe care throughout our four-county region. So that's Okanagan, Grant, Chelan, and Douglas. I think me taking the program director position at American Behavioral Health Systems Parkside was really in alignment with suicide-safe care.
A total of $8 million has been spent getting the 32,000 square foot space ready for its new role within the community, and upon its opening, the facility will offer 16 patient rooms which have been specifically outfitted with safety in mind.
So this is one of the patient rooms for the crisis stabilization. What you'll notice is that the beds are anchored, the lights are suicide safe, the fire sprinklers have been embedded into the ceiling for the very same reason. You'll notice the door handles are ligature resistant. So everything is really about suicide safe care.
Parkside's patient units are not the only thing on its grounds to feature a very unique set of safety features. Its patient intake area next to the building's sally port was also designed with this in mind as well.
So this has been welded so that you'll notice that they can't hang from this. There's nothing that they can do. It's all ligature resistant. All of the fixtures in here, the mirror, the toilet, everything is looking at suicide safety.
While the physical safety of its residents is definitely one concern that went into Parkside's construction, the mental well-being of its patients was certainly not overlooked either.
So the reason that we chose some of the pictures in the unit is because research for crisis facilities shows that if we hang pictures of people doing things, people tend to get better and they start thinking about the types of things that they could be involved in that would help them get better.
Parkside already employs about 50 people, which also accounts for a staff of 20 mental health professionals led by and including Dr. Rickard, who also has worked with a number of other regional entities in an effort to better coordinate the facility's services.
Part of the work has been around making sure that we're partnering with all of the local agencies. So that would be the different mental health facilities, Catholic Charities. They have the crisis contract currently, and then also law enforcement. So we've had several law enforcement meetings around creating pathways of care and making sure that law enforcement, whether they're in Quincy, Ephrata, in the Grant County area, up in Okanagan, Chelan, and Douglas, both the sheriff's departments as well as the cities, understand what their officers should be asking to make someone a good candidate for our facility. So we've created those pathways. We've then worked with the director for the ambulance companies and met with them to create a pathway for first responders so that they know how to, if an ambulance first responder has someone that they want to put in our facility and they think, you know what, instead of going to the emergency department, which our facility is designed to really take some of the burden from emergency departments, it would be them being able to route someone directly here using the criteria that we developed together.
Dr. Rickard says they hope to eventually expand the facility's reach of services to include an evaluation and treatment center, which would create a dozen more patient rooms and up to 50 additional staff members. The American Behavioral Health System's Parkside Crisis Stabilization Center is currently on track to care for its first patients by late October. Reporting for iFiber One News, I'm Chris Hansen.